Hey everyone, and welcome back to the channel. Today we re-tackling a question many people are too shy to ask. Can you get a urinary tract infection or UTI from sex? First things first, a UTI is not technically a sexually transmitted disease. You can't catch it from a partner, in the same way you catch an STD, however. Sexual activity is a major risk factor for developing a UTI. So what's the connection? A UTI happens when bacteria, most commonly E. coli from the digestive tract, get into your urinary system and cause an infection. This leads to those awful symptoms many of us know all too well. A burning sensation when you pee, feeling like you have to go all the time, cloudy or strong-smelling urine, and even lower abdominal pain. So where does sex come in? During intercourse, the physical motion can push bacteria from the surrounding area, like the anus or vagina, into the urethra, which is the tube you prue. From there, it's a short trip to the bladder, where the infection can take hold. This is why women are much more prone to UTIs than men. A woman's urethra is shorter and located much closer to the anus, making it an easier journey for bacteria. For men, UTIs are less common. Their urethra is longer and ejaculation can help flush out bacteria. However, men are not immune. The risk for men can increase with certain activities, like anal sex, which can introduce bacteria into the urethra and potentially lead to an infection. Now let's talk about something really important: how a UTI affects your sex life. If you have a UTI, having sex is probably the last thing on your mind, and for good reason. The condition itself makes sex incredibly uncomfortable and even painful. Think about it. The main symptoms are pain, burning, and a constant ache in your lower abdomen. Any activity that puts pressure on that area, including sex, is going to make you feel worse. The inflammation in your bladder and urethra is already causing discomfort, and the friction from sex can seriously aggravate it. Many people find their symptoms, especially the burning and frequent urination, get much worse right after being intimate. Furthermore, continuing to have sex while you have an active infection can actually make things worse. It can push more bacteria into your urinary tract, potentially worsening the infection or even causing a new one right after you thought you were getting better. This can slow down your recovery and create a frustrating cycle of reinfection. This brings us to a crucial question: should you avoid sex completely when you have a UTI? The short answer from medical experts is a resounding yes. It's really best to abstain from any sexual activity until you have completed your treatment and the infection is fully gone. Giving your body a break allows the inflamed tissues to heal without further irritation. It also prevents the introduction of new bacteria that could complicate your recovery. Think of it as giving your urinary tract the time and space it needs to get back to normal. If you suspect you have a UTI, the most important step is to see a doctor. Don't just wait for it to go away on its own. A simple urine test can confirm the diagnosis, and your doctor will likely prescribe a course of antibiotics to kill the bacteria. It's vital to take the entire course of medication, even if you start feeling better after a day or two. Stopping early can allow the infection to come back stronger. So, how can you reduce your risk of getting a UTI in the first place, especially one related to sexual activity? Prevention is key, and there are several simple habits you can adopt. First, hygiene is your best friend. Gently clean your genital area with plain water before and after sex. One of the most effective tips you'll ever hear is to pee both before and, most importantly, right after sex. This simple act helps to physically flush out any bacteria that may have entered the urethra during intercourse. Practicing safe sex is also important. If you engage in anal sex, using a condom can help reduce the transfer of bacteria. And a critical point: never switch from anal to vaginal sex without changing the condom. This prevents the transfer of E. coli and other bacteria directly to the vaginal area and urethral opening. Finally, don't underestimate the power of hydration. Drinking plenty of water throughout the day keeps your urinary system flowing. This not only helps to flush bacteria out regularly, but can also dilute your urine, which may reduce that stinging, burning sensation if you do get an infection. To sum it all up, while UTIs are not sexually transmitted diseases, sex is a significant trigger. Having a UTI can make sex painful and can worsen the infection. The best course of action is to see a doctor for treatment and avoid sex until you're completely healed. By practicing good hygiene, peeing after sex, and staying hydrated, You can significantly lower your risk and keep both you and your urinary tract happy and healthy. Thanks for watching, everyone. I hope this cleared things up for you. If you found this video helpful, please give it a thumbs up and don't forget to subscribe for more health and wellness content. Stay safe and take care.